find that in any type of mobility practice, ankles are frequently neglected, okay? So if you are someone that has had a history or currently has a problem with plantar fasciitis or foot or ankle pain, or if you have trouble with squatting, for example, then you may want to check your ankle mobility. And if it's lacking, then you're going to want to incorporate that into a mobility program. So what we're going to do in this video is I'm going to show you an easy way to incorporate dorsiflexion ankle mobility. So that is the toes coming up and decreasing the angle right here. Okay. We're going to talk about how to increase that range of motion. So first, you're going to start in a kneeling position. Now, if it is uncomfortable for you to be on your knees, you can get a pillow or a foam pad and put it under one knee, okay? You're going to bring your other leg right up to where your foot is in line with your knee, okay? Now, the goal here is you're going to work on stretching the back of your calf by leaning forward. You can use your body weight to kind of push this knee down. The goal is to get the knee about 4 to 5 inches past the foot, okay? So to start, we're just gonna hold this stretch. You can hold for about 10 deep breaths. Remember, when we're doing stretching, we wanna be breathing in through our nose, out through our mouth, help trigger that relaxation system. You can back off a little bit and then go back in to that stretch. You want to make sure that while you're doing this, though, the heel is not coming off the ground, okay? If your heel's coming up, you're compensating, and you're going to be feeling this stretch all in the back of this calf right here. Good. Now, what I want to do is, if kneeling is not an option for you, whether it hurts your knees or you just don't have that mobility, I do want to show you an option in standing. You'll just need like a bench or a chair, okay? And you're going to do the same thing. You're going to work on pushing this knee forward, keeping the heel down. I want you to use your hands for balance here though, because we don't want to be fighting our balance. Here, we want to just really be focusing on the stretch. Also, go forward. When you're doing this stretch, you want to make sure that that knee is tracking right over the second toe. Okay, that angle is going to give you the best stretch in the back of your calf. If we're going more to the outside or letting that foot cave in, we're not isolating the gastrocnemius and the soleus, the calf complex. So you want to go right over that second toe. Okay. Now, there's also another alternative. If you have a band or even a belt, it doesn't even have to be a band, you can wrap this around your ankle to help actually mobilize the joint. So what you're going to do is you're going to get in the same position that you were. You can, again, do this in kneeling or standing. And have the band or the belt hitting right at the crease of the ankle. And then as you rock forward, you'll feel that band / belt pulling back against the ankle and mobilizing that joint. And you can see I have a little less range of motion here on my right side as compared to the left. Okay. So that's going to be your passive stretch or your passive mobility. Now, after working passive mobility, we want to make sure we're moving through that new range of motion. Okay, so you're going to come into more of a half kneeling position. Again, you can put that pillow under your knee if you would like, and you're going to go back into that testing position, okay? So with your toes about 4 to 5 inches away from a wall, you're going to work on rocking that knee in, working on touching that wall, nice and controlled. Again, you're going to want to keep that heel down. So if you can't get all the way to the wall, go as far as you can without that heel coming off the ground. And you're going to do that 10 to 15 times. Okay? So this is increasing dorsiflexion mobility of the ankle.